Hi, I'm Dr. Kave, a Stanford and Harvard-trained, board-certified anesthesiologist and integrative medicine specialist. And my patients are rarely ever told how much power they have to heal themselves, even here in the operating room when they're under anesthesia. Because society downplays and often ridicules the mind-body potential in favor of real medicine like pills and injections, and enforces cognitive rigidity in helping my patients think that they can't take control over their health. So let me share patient stories to change that, where patients have beaten conventional wisdom that told them what they could and couldn't do to pull through and actually heal themselves. It starts with clinical hypnosis, which is just a fancy way of saying that you're in a suggestible state. Kind of like a super strong placebo, except unlike a pure placebo, this is actually changing your brain's neurochemistry and all the biology in your body. My patient the other day had a serious heart condition and couldn't tolerate the anesthesia that they needed to have that surgery under general anesthesia. That's because anesthesia turns off the nerves all throughout your body, not only your brain, but also the nerves in your heart. And if you have pre-existing heart disease, like this patient did, you may not be able to tolerate a full load of anesthesia to go fully to sleep. So I was left with either not doing the surgery with anesthesia, or by giving just a little bit of anesthesia so their heart wouldn't fail, and using clinical hypnosis to make up the difference so they could safely and comfortably have their surgery. Nobody wants to have surgery wide awake. That would just be really painful, right? So I did a nerve block to reduce some of the pain, not all of it, and I gave a little bit of anesthesia to help calm the nerves and literally loosen them up a little bit so that we could easily enter a suggestible state. Like I said, clinical hypnosis. This patient had never heard of hypnosis before and wasn't really on board when I first brought it up. But with just a little bit of relaxation, we were able to enter a suggestible trance state where the surgeon was able to start cutting and doing the surgery, and the patient was entirely okay. In fact, they were so okay that they woke up after the surgery from their trance state super appreciative and thankful and weren't in pain and didn't remember feeling any of the surgery at all. That's the power of combining the best of Western and Eastern medicine so we can take full advantage of the body healing itself. The problem is that society is always telling us what we can't do, like you can't be happy unless you buy these clothes, or you can't be healthy unless you take these medications in the US and in New Zealand where direct-to-consumer drug advertising is legal, or you can't feel good unless you buy what these influencers are trying to sell you. Hypnosis is just one mind-body technique to take control of your body so that you can do the things that society is telling you you can't do. Like to control your anxiety, control your stress, or to empower yourself to live with more joy and to do the things that you ultimately want to do. By removing these blocks to achieving your inner potential, your body can do things that you never thought possible. The main problem is cognitive rigidity, literally a rigid mindset that prevents your mind and body from adopting new mindsets, like ones that help you tap into your inner healing potential to accomplish those things that you probably didn't think possible. Anesthesia can stimulate your mind to literally soften up that rigid mindset so that you can accept the body's potential to do things like heal itself that others may have told you are impossible. Please don't take this the wrong way. You don't need anesthesia to enter this type of hypnotic trance state where you open your mind and body up. This can also be done with spiritual or meditative practice, or with psychedelics. There is no one-size-fits-all solution in medicine. I pick what's right with the patient in discussion with them so it matches their disease severity and their personal preferences. Holistic medicine is the only real medicine that takes into account the patient's past histories. It's not me pushing my preferences on what I want to do for the patient, because it's the patient's life that goes into what the ideal healing solution is for them. And that's what you should look for in your doctors, so that you can take the driver's seat in your healing, so that you can tap into your inner healing potential and do all those things that society tells you you can't do.